Today I want to talk about acute renal failure. Specifically, what's the difference between pre-renal, intrarenal, and post-renal failure? By way of review, let's remember that unfiltered blood comes into the kidneys to have nitrogenous waste removed and excess fluid, and then the blood leaves the kidney and goes back filtered to the rest of the body while urine and waste comes down through the ureters. But what if something happens to the kidneys and you go into acute renal failure? Let me just remind you, acute renal failure is any rapid decline in renal function with waste buildup, also known as azotemia, and fluid and electrolyte imbalances. And this acute renal failure can have three different types: pre-renal, intrarenal, and post-renal. Let's begin by looking at the pre-renal. This is the most common type of acute renal failure. Pre-renal failure means that something's happening before you get to the kidneys. So I give you the example here of hemorrhage. So let's say you're losing blood and all of a sudden your blood pressure goes down, you begin to hypoperfuse the kidney, and then the kidney then begins to suffer some damage rapidly. This is going to be considered a pre-renal failure because it's happening before you get to the kidneys. Next, let's talk about intrarenal failure. Intrarenal failure includes anything that happens inside the kidneys. It actually happens to the kidney itself. And so this is going to be things like an infection of the kidney or maybe some nephrotoxic effects of medications. That's intrarenal failure happening within the kidney. Finally, let's discuss post-renal failure. Post-renal failure is anything that's happening after the kidneys. So it's not before the kidneys, it's not in the kidney itself, but it's actually after the kidneys. Think something like an obstruction. If you have a patient with BPH, or maybe there's a renal stone that's blocking this area, causing the urine to back up and cause damage to the kidney. So let's recap. You have pre-renal failure, which happens before the kidney, intrarenal failure, which happens in the kidney itself, and post-renal failure that happens after the kidneys, causing something to damage the kidney. I hope that helps. Like and follow for more content like this.